Hello everyone, welcome back to the channel. Hope you're well, thank you for joining me again. Another video for the day, and this time I want to talk a little bit about our health service. I saw an interesting thing online, and I'll read this to you now. It's a short excerpt. A new contract agreement between the British Medical Association and the Government of England for the 2025-2026 GP service year has been ratified. This contract introduces online booking for GP appointments, aims to rebuild the family doctor-patient relationship and seeks to reduce bureaucratic red tape. The deal, which includes an additional $889 million in funding, is described as the first step in revitalising general practice within the NHS, with stipulations for further contract negotiations within this parliamentary term. Haven't we heard all this before? I mean, let's break this down, shall we? This contract introduces online booking for GP appointments. I don't know about your doctor's surgery, but at the moment I've got this thing. It's called eConsult, and there's another version of it and another doctor's surgery around the corner. You pull it up, you fill in a form, you ask for an appointment. So this is there already. And to give you an example, I mentioned in a video a couple of days ago now, probably Saturday, that my knees are knackered. I've got a horrible tear in the cartilage in my knees, and I'm waiting for an MRI scan, and I'm waiting, and there's a friend of mine in my karate class who's got exactly the same problem with his knees as I've got with mine. A month he waited for an MRI scan, a whole month. Could you imagine if you're a driver or, you know, a painter and decorator or anything involving standing up or using your feet for a long time? Crazy, isn't it? £889 million in funding. My mum, we were sat at the hospital, A&E. She cracked one of her ribs. Thankfully, she'll be okay. She's just in a lot of pain, and it will be better. But there was a notice board that popped up on the screen, and it had the hospital's directors. Underneath it had executive deputy directors, and there was about 8 or 9 of them in total. For, you know, at least 4 on each line. And I said to my mum, that's the problem right there with the NHS. It's top heavy. Too many managers, and there's not enough money getting put into play at things like nurses, doctors, ambulance transport and all this sort of thing. And this £889 million in funding, while it's meant on the face of it to improve our GP services, that won't happen. That will go to top heavy management, executives and all the rest, as it always has done. It's really very simple. And also you've got the provision of care for elderly. I mean, my mother-in-law sadly passed away on the 6th of February, and when she was transported to our house, she was brought in by a private outside ambulance firm because there was no NHS vehicles available. She was thrown onto the bed in here like a piece of meat at a butcher's. 3 weeks later, she died, and the treatment she received from that ambulance crew certainly didn't help her cause, and this is something that was outsourced. It was pretty disgusting. In due time, you will hear more about that if we can prevent that from happening to any other families. But, you know, all these things combined, and I read this already, in 5 years' time, I could sit here again and relay more stories like this to you and nothing would have changed. You really break down these statements, the online booking we have already, but the rest of it, it's just going to be complete mismanagement of funding, as it always is. In truth, and I know this because I had a relative that worked for the NHS some years ago, there are very large parts of it that have been privatised already, and it's been pulled apart and subcontracted here, subcontracted there. It's a joke. It really is a joke. Now, I know that there is a suggestion of vouchers. So then you have a voucher, and then if you can't be seen within an amount of time, you will be seen by a private practitioner at the NHS's expense to get all the waiting lists and everything down. But the NHS in its current form isn't fit for purpose, and £889 million, I don't think it's going to cut it either. Let me know what you think in the comments. I've given you some of my experiences. It'd be interesting to hear some of yours. Let me know. I look forward to talking to you soon. Toodaloo.